Welcome everybody. We're here at Bio International Convention 2022 here in San Diego. And I have the honor of being with Michael Salgaller, who is with NIH. And Michael, let's start with this. I mean, technology transfer is your business at NIH. Can you talk a little bit about that?
Sure, happy to. So technology transfer is simply that our scientists, inventors on our own campus in Bethesda, Maryland, they come up with an idea, technology, something that hopefully will address and improve global health. And as a federal agency, we cannot commercialize that technology. So the technology has to be transferred to an industry partner who will then take it to market and take it to the patient.
You know, typically when people think of NIH, they think of basic research, they think of, translational science, but technology transfer seems to be something I think most people don't really think about.
Right, so we're much better known as being the largest basic biomedical research center in the world and the largest global government funder of medical research around the world. And our academic mission is a very, very important part of what we do. We also have very important global health initiatives, such as the Cancer Moonshot. In addition to that, though, every year we work with and license to hundreds of various companies in order to get that innovation to the patients who desperately need it.
And what sort of funding are we talking about? I mean, on an annual basis, the technology transfer portion for NIH?
So the portion that we fund around the world to fund innovation is now over $40 billion. We solely concentrate, my group does, on the innovations and projects of our own scientists on our main campus in Bethesda, Baltimore, and a few other NIH campuses. Now, what we provide, instead of direct support, where basically you apply, it's a competitive process, you are reviewed and scored, and if you receive a sufficient score, then you're given direct funding. What we're involved with is indirect or in-kind support, whereas for a lot of the projects that we run with companies, we help support it with either staffing or we contribute financially to putting the house together. And so that is known as in-kind or indirect support. So we don't write you a check, but we will spend money on your behalf to help get the technology forward.
And in terms of staffing, how many tech transfer professionals do you employ?
So across the NIH offices, we have hundreds, and most of them come from either the scientific realm and or the legal realm. And they are what I call the boots on the ground. They are the Sherpa guides. They are the experts who work individually with our 8,000 scientists, and they help patent their inventions, they help negotiate their agreements, and they help prosecute their patents. So they are the ones who do all the legal agreements and determine when the technology has gone to a point where it's not just publishable, but it's gone to the next step of it's patentable.
I mean, that's interesting. I mean, intellectual property is not typically a function that people associate with NIH.
That is very true. If you look at our mission statement, it includes things that would not surprise you, such as improving global health. It also includes that we're supposed to take the funding that we're provided by Congress and the US taxpayer and actually have a return on investment in two ways. And one of those is improving the quality and quantity of lives around the world, especially in the US. And then part of our mission statement is actually includes to facilitate economic development in the US. So to take the money that we get from the US taxpayer and from Congress and helping in part of our mission, companies succeed, get important medical solutions to patients, and therefore grow, hire more people, lease more space, pay more taxes, and in that way have a return on the investment. Now, sometimes working with these companies, we also take in funding, and that can supplement the funding that we receive from the US taxpayer. And that funding allows us to do research that is additive, that we hadn't planned on doing when we submitted our budget before each fiscal year.
And in terms of like M&A activity, do you get involved with a company when it's at the point where they may be merging with others, or they may be going public, for instance?
We work with companies of any size and any geography. So that is from a startup company all the way to, we probably work with most of the top 10, 20, 30 biopharmas and pharmas. So the companies that we work with, there isn't an exact number. How big do we need to be? How much staff? How much financial support? If they're going to collaborate with us, we just need to know that they have the personnel to do the project, because we're both contributing effort, and that the financial backing to help support whatever part of the project they need to fund. And we also need, if they're going to license, they need to have a commercialization plan for how they're going to take the technology and get it to the patient.
And what about, the legislation that's been in place for some decades now, right? The
Bayh-Dole Act.
Bayh-Dole Act, exactly. It goes back to 1980. I mean, that's been there, and it's been ensuring that people's intellectual property and tech transfer is all guaranteed.
It allows us to license technology that were developed with public dollars. So there's a lot of companies that we currently work with. We have hundreds and hundreds of industry partnerships. Just at NCI, the National Cancer Institute, where my particular office is, we execute 3 licenses a week. So we do a lot of activity. However, there's a large percentage of our inventor portfolio that is unlicensed. And we at NIH are not permitted to start companies. So therefore, working with an industry partner to get that technology out of the lab bench to the clinic and to the marketplace is a must-have. It's not a nice-to-have. So our group was formed by the director about 7 or 8 years ago to act in an alliance development function to communicate to the world that we're not just interested in working with academia, and also to let them know that the technologies that we've developed by our own scientists on our own campus are available for partnering and also for licensing.
Just on that point, I mean, what percentage of the funding actually goes to academia? Because I think most people assume that academic research is the sort of the driving engine for much of that.
Right, and that is the case. So it's ballpark around 90%. I could be off 5% or one way or the other, but the majority continues to go around the world to fund academic science and more basic science. We also have the Small Business Innovative Research Grant Program. Now that is for only US companies, US entities. However, it is our one direct funding mechanism specifically for small businesses in the US.
So it's fair to say that NIH is open for business.
We are, and so a lot of the the marketing and promotion we do is for the major initiatives that we have in the outside world, such as the Cancer Moonshot program is a good example of that. We don't, appropriately so, we do not devote a lot of resources to promoting our own accomplishments. That's not a good use of tax dollars. So what we have is we have this small team, and our mission is to go out and we can work with companies. We also work with economic development entities and trade associations. We work with a lot of professional organizations. We work with law firms. We work with consulting firms, regulatory firms, even commercial developers. And it's a very informal relationship. It's just that their client base, if you're a law firm, if you're putting up a 100-company biopark as a commercial developer, we say that your clients, your customers, could be our partners. And so they're very good, once we inform them of our value proposition, that they serve as a referral source. So, we need leads, we need deal flow. You don't often think of NIH as doing that, but we have a lot of really promising technologies that are sitting on the shelf legally and sitting on the bench from a scientific standpoint that don't have a partner and they don't have a licensor. And so they really need to get out of NIH and get moving to the clinic and then to the patient in the marketplace.
You mentioned the cancer moonshot. Are there other initiatives that you're trying to generate interest and participation in?
Well, our group, NIH has dozens of different initiatives which are called external or extramural consortia. So in addition to the 27 different institutes at NIH, which are usually divided by organ system or disease, so like the National Eye Institute or the National Cancer Institute, you could also divide us by external or extramural and internal or intramural. So the external or extramural part is the part that provides direct funding all around the world. So if a company is interested in licensing a technology from a university or research institute that has received NIH funding through the extramural program, they would go to that awarded institution for that particular collaboration or that particular license. We're solely dedicated to our own 8,000 scientists on our own campus we have a couple campuses, Baltimore, and we also have one in Montana. We have one in North Carolina for environmental health sciences, and our main one in Bethesda, Maryland. So our particular alliance development group within Tech Transfer, we're solely focused on the intramural programs, and then there are communications and public liaison teams whose mission is to promote and create awareness of these large external group or consortia projects that NIH supports.
So if a company wanted to reach out to the tech transfer program at NIH, how would they do that?
So it's as basic as getting in touch with us and letting us know your interest. The one for NIH is simply techtransfer.nih.gov. If you're interested in the cancer realm, it's techtransfer.cancer.gov. And there's contact information to begin the conversation. For my particular group, if you met with me, I would want to understand your strategic interests. If you're coming to me and you're in a company that's in therapeutics, diagnostics, devices, telehealth, wearables, e-health, digital health, chances are that you are trying to penetrate a market for which we have an ongoing program. I've got a slide that shows the areas last year that were the largest funding areas for venture capital investment, things like oncology, metabolism, immunology, cardiovascular. We have got research programs in the top 12 areas that were funded in venture capital. So we know that it has the interest of the investment community. So that part is there. So if they get in touch with us, we'll actually try to learn, what are you interested in doing with us? Are you interested in adding to your pipeline through a straight license? Are you interested in collaborating with us? We can collaborate preclinically. We can also collaborate with you clinically. Among the things that's not well known about the NIH is that we're the largest clinical investigation center in the world. So what that means is, while other centers have more patient beds and they may numerically see more patients, we run more first-in-human experimental trials than anyone in the world. We, in fact, almost exclusively run experimental approaches that have no validation in patients, which is, when it comes down to it, the only animal model that matters, unless you're developing something for veterinary. And we do a little of that too.
Right.
So they can just contact me or someone in my office, and someone will direct you to the right tech transfer office within the right institute and center. So a couple brief examples: if you had something in COVID or infectious disease, that'd be the National Institute of Allergy and Infectious Disease. And if it was something in cardiovascular, Heart, Lung, and Blood Institute. For cancer, it would be, for example, the National Cancer Institute.
And I think you were saying earlier that these companies have to have a commercialization plan, right?
Well, in order to license from us, part of the licensing agreement is to have a commercialization plan in place. As a federal agency, that's very important because they will get rights to those areas of the technology that they have concrete plans to develop. And that's very important because we cannot use the public dollar, if you're a company, for example, to give you rights to everything, just so you can block everybody else. You will get rights to as many things as you can demonstrate you plan to take to the patient and actually improve public health in. And that agreement can be revisited at any time. But because we're publicly funded, we are unlikely to give you rights to the entire world and any possible indication, even ones for which there is no data, just so you can keep your competitor from touching that technology.
That's fascinating. I think people have learned today something new about NIH. I know I have. And so, Michael, again, it's been a pleasure talking with you. And we will have continuing coverage from Bio 2022 here in San Diego. See you then.